my key message today when I'm talking about blood pressure and guidelines is to make the point that we are pretty good when we look at patients who are in their 60s and 70s and even their 80s who've already got evidence for cardiovascular disease. We know pretty much what to do with their blood pressure, what sort of drugs to use, how we can optimize our results. And they are a very important group. Most people in the doctor's waiting room are in their 60s, 70s, and 80s. So that is good information and good news. But the big question for the future is, how do we address people who are younger with less severe forms of hypertension and fewer complications? And that's something I want to raise as well, because it's up to the young generation of researchers to go looking for those answers.
So are you saying then perhaps we should lower the blood pressure limits for younger people?
Yes. I would say that when it comes to treating younger people, our present guideline of 140/90, which is, I think, well established now. I have no problems with it. But for someone perhaps in their 20s, 30s, 40s, or early 50s who's got hypertension, it may be perfectly safe and it may be ideal to try and get their pressure down below 130/80, even closer to 120. And that's something we need to find out, because I really think we can make important interventions there.